Gynecologists. What's the grossest, strangest, or most shocking thing you've ever seen in your career? Bon appetit. I've been a gynecologist for 12 years. Over that time, I've seen so much that my disgust threshold seems to have evaporated. But one story I'll never forget. A woman in her mid-40s came in with vague, lower abdominal pain. Standard complaint, nothing special. We put her in the chair, I start the exam, and immediately something's off. Something foreign. I start carefully removing it. It was a perfume bottle. Small, glass with a cap, completely intact. She said she had no idea how it got there. I didn't believe her. I'm not a gynecologist, but I worked as an ER nurse. One night they brought in a woman around 30, fully conscious but clearly in shock. We start figuring things out. Turns out she'd been having sex a few hours earlier and felt something strange. She went to the bathroom, didn't find what she was looking for, and figured everything was fine. But the pain didn't go away. Eventually, we removed a used condom that had been inside her for almost 8 hours. The smell in the exam room lingered for 3 days, despite everything the janitors did. I'm a med student, doing my rotation in gynecology. From day one, they told me, prepare for anything. I thought I was mentally ready. I was wrong. On the third day, a 16-year-old girl came in with her mother. The mom was completely calm, which was already strange. Turns out, at age 10, the girl had inserted a tiny toy figurine, a cartoon character, and had stayed silent ever since. 6 years. The figurine was almost fully encapsulated by tissue. When we removed it, I walked out into the hallway and just stood there for 5 minutes, staring at the wall. I've been a gynecologist for 18 years. I've seen it all. But here's a story my colleagues still bring up at parties. A middle-aged woman came in, very well groomed, nicely dressed, complained of discomfort. I put her in the chair, start the exam, and feel something hard. I carefully remove it. It was a stone, just an ordinary smooth river rock. Without blinking, she explained she'd read online that it helps with back pain. The source, some wellness blog. I asked her to stop reading that blog. I'm not a gynecologist, but my friend is a midwife, and she told me a story that still keeps me up at night. A pregnant woman came to their ward. The delivery was normal, everything fine. But a few hours later, complications started, so the doctors went to check. Turns out, while the nurses were busy with other patients, she'd removed her own stitches because, quote, they were itchy and annoying. My friend says that was the first time in her career she was speechless. I'm a gynecologist. One of the strangest cases in my practice was a patient who came in every 6 months like clockwork. Nothing unusual, right? The unusual part was that every time we found something new inside her. First time, a marker cap. Second, a small plastic stopper. Third, a piece of foam. We referred her to a psychiatrist. She got offended and switched to another gynecologist. I hope he had better luck. I'm a nurse. We had a patient, a sweet 75-year-old grandma, always smiling, always giving candy to the staff. Came in for a routine checkup. The gynecologist starts the exam and suddenly stops. Walks out, calls me in. I go in. Inside her, a rolled-up piece of paper. We unfold it. It's a prayer, handwritten, in neat, elderly handwriting. She explained that a knowledgeable woman in her village taught her to do this for health. The prayer had apparently been there for weeks. We all just stood there in silence. No one had the heart to judge. I'm a medical student, doing my rotation in gynecology. First day, first patient. A woman comes in, sits down, starts describing her symptoms. She has a very strong accent, and I don't understand at first. Then it clicks. She says, something is moving inside me. I think I've misunderstood. The doctor starts the exam. Pause, long pause. Then, very calmly, in the most professional voice, tell me, have you been outdoors recently? Turns out, a tick. How it got there, we never figured out. The patient herself was deeply confused. I'm a gynecologist at a small private clinic. A patient comes in complaining of burning and odor. Nothing new. I start the exam and immediately notice the smell is off. It's not a bacterial infection. It's something else. I try to find the source. I remove a piece of hard cheese. I'm serious. Cheese. The patient calmly explains she used it instead of a suppository from an internet recipe for yeast infections. I closed my office, went outside, and stared at the sky for 5 minutes. Then I came back and continued my shift. My mom worked in gynecology for 20 years. She rarely tells stories because she says most normal people wouldn't handle it. But one day she came home, silently put the kettle on, silently drank her tea, then looked at us and said, today a woman came in with a cucumber. She said it was medicinal, that she'd kept it inside her for a week. It was not medicinal. Then she stood up, went to the bedroom, and went to sleep. We didn't bring it up again that evening. I'm not a gynecologist, but I worked as a hospital janitor. We had a woman on the ward post-surgery. She'd been warned. No physical activity, complete rest, don't touch the stitches for at least 3 weeks. 5 days later, she called the nurse. I think something went wrong, she said. Something went wrong. That's an understatement. She'd removed the bandage herself and decided to check if everything was okay, using a small mirror and apparently her fingers. The stitches had come apart. The surgeon who came to repair it didn't say a single word, just silently did his work and left. We watched him stand in the hallway afterward, staring out the window. I'm a gynecologist. The strangest conversation of my career happened a few years ago. A young woman, around 20, came in, complained that something was off with her cycle. I start asking the standard questions. I ask if she's sexually active. She says, no, of course not, never. I continue the exam. Everything points to a pregnancy of about 8 weeks. I very gently tell her. She looks at me. 20-second pause. Then, quietly, so, you can get pregnant just like that? I said, yes, that's basically how it works. She was quiet for a very long time. My grandma worked as an OB/GYN for 20 years. She She says she saw things no horror movie could match. But her shortest story is this. Once, after a shift, she came home, walked into the kitchen, looked at the meat thawing on the counter for dinner, and said to my grandpa, "Put that away. I can't explain why, but put it away right now." He did. They had buckwheat for dinner. She never explained. I'm a gynecologist. Sometimes I think human ingenuity knows no limits, especially when people binge internet forums. A patient comes in, complains of irritation and itching. I ask if she's using anything unusual. She hesitates, then says, "Well, I read that garlic helps with fungus." I clarify, "And you?" "Yeah, a whole clove overnight." I explain it's a folk remedy. It doesn't work, and she should see a doctor for these issues. She nods, leaves. 3 weeks later, she's back, again with irritation. I ask again. She hesitates. "I thought last time I just didn't use enough." She inserted 3 cloves. 3. I'm a nurse, a veteran. I've seen a lot, but here's what I'll tell you. After all these years, what broke me wasn't some specific disgusting story. It was one small moment. A very young girl came in, maybe 17, terrified, afraid to make eye contact. We did everything carefully, gently, as calmly as possible. As she was leaving, she turned around and said, "Thank you for not laughing." I asked, "Who laughed?" She shrugged. Turns out she'd been to another place before, and a nurse there had made a joke to a colleague. That's what I remember, not the horrors. That.